All right. Hello, hello. Welcome, everyone. Hello, hello. We will wait for just a few seconds um, to get started in case someone is trickling in. I'll try to share my screen to see if it works. Oh. All right. Can everyone see my screen? All good? All right. So why don't we all get started? Because we want to respect everyone's time. We want to welcome you all and thank you so much for joining us today. We are very excited to have you join us during this European Mental Health Week, and we are grateful that you are taking time to be part of this conversation. So I will chat a little bit before I transition to other team members, but in the meantime, feel free to add in the chat where you're joining from, and if you can, in one word, describe your youth mental health support in your country right now. What is one word for that? So my name is Ruta Rangel. I'm a health psychologist and global mental health specialist. I work as a program manager at the Center for Global Mental Health Equity at George Washington University. Even though I live in US, I am Lithuanian. And in this initiative, let's see, I am a learning lead. And we will dive in a little bit more in terms of other team members. So today we are joined by a really wonderfully diverse group of participants, including researchers, funders, people with lived experiences, youth, practitioners, community members, essentially people passionate about youth mental health. This diversity is actually exactly what makes this conversation so important because youth mental health cannot be improved by one sector or one voice. We all need to work together. So before we begin, very quick, a few housekeeping notes. Please keep yourself muted when you are not speaking. We really want to hear from you, and we will have the opportunity to hear your thoughts, suggestions, recommendations, and questions later in the webinar. But in the meantime, if anything comes up, if you have any questions, recommendations, or suggestions, please put it in the chat, and we will address that. You also must have noticed that we are recording this meeting. So if you're not okay with it being recorded, please chat us directly and we can pause the recording. So quickly, today's agenda is to give you a clear understanding of the Let's See initiative, including what that is, key achievements so far, the proposed service model, ways to get involved, and presentation of the Artsy exhibition. And to begin with, I will give you a quick appetizer of Let's See initiative. So a little bit of taste, what that is. And then later on, we will transition a little bit more into depth. So let me, all right. So Let's See. Mission is to improve young people's mental health in Central and Eastern Europe. And why is that important, right? So it is important because we know that around 75% of mental health conditions develop before the age of 24. So we want to tackle them early on and provide services as soon as we can. We always know that we also know that in the region, there are significant challenges when it comes to mental health. The region has really high suicide rates, and in fact, lots of young people that require mental health services. But they may not be always accessible. They might be accessible, but in urban settings, not necessarily in rural settings or any other setting where people live. They could also be providing services that the youth is not really seeking. So like hospital-based care, medication, um, and all of this is actually perpetuated by high stigma, geopolitical instability, and inflation crisis. So certainly there's a need for better mental health support for youth. And I always think that we need just a couple of passionate people to start moving the mountains. And here those two people are. So Kata and Jofi in this photo and on this call are the co-founders of Let's See. So these two fabulous, passionate ladies decided to do something about having an impact of mental health services in the region. So without these two ladies, I wouldn't be on the call, and probably this call wouldn't exist. So thank you for thinking about all of us. So very briefly, again, this is just an appetizer. So what do we do? What is Let's See about? So we build youth mental health hubs for for young people who could not otherwise access services across Central and Eastern Europe. So our aim is to provide free mental health services where youth can come in, hang out, and also at the same time receive some support. So we essentially have different oversight. We have a regional team that develops and maintains a regional wide service model, creates quality measures, and conducts cross-country research, and also creates a community of youth mental health professionals across youth hubs and external partners. But we also have local teams that design, implement, evaluate, and scale these youth mental health hubs. So our core values are regional collaboration and youth-centered care. So just to highlight once again, this is not service only for youth, but this is a service created by youth for youth and people with lived experiences. You already heard about me a little bit. This is our very female-led group. This is the regional team. So I already mentioned Jofi and Kata, but I also want to mention Rita, who is our fabulous outreach lead, as well as Milena, who is our research lead, and you will hear from her soon. Our work would not be possible by a large number of individuals who are as passionate about youth mental health as we are. So we have a community from different countries in Europe, and we have over 60 members already. Before I transition to my colleagues, I also wanted to mention that this European Mental Health Week reminds us that mental health cannot be addressed by individuals or services working alone. So the theme Stronger Together is especially relevant for Central and Eastern Europe, where young people face shared challenges. So as I mentioned, stigma, limited access to care, fragmented services, and too few youth-friendly spaces. And I'm sure most of us are pretty familiar with that. But we also share strengths, creativity, and a desire to shape solutions. So this is what Let's See does. We build on this idea by bringing young people, bringing families, practitioners, communities together to co-create community-based youth mental health hubs across the region. So I will stop sharing. And just very quickly want to see if our guest speaker has arrived. We have a few more segments prepared for you. We will hear from Milena, who will describe key achievements that we have done in the past year. And we also will hear from Christina Pollock, who is a member of Let's See, and will talk about her experience. Sorry, I'm losing my voice. All right. And before our speaker joins us in 1 minute, I just want to see, I see people from Ukraine, Turkey, Nigeria, Hungary, Netherlands. Oh, that's fantastic. We have so covered all the world in one call. Jofi, perhaps we could transition to artsy exhibition that you could briefly mention, and then we transition to Christina. How does that sound?
Yes, that's perfect. So hi everyone. It's fantastic to have all of you here from We are standing up for youth mental health in Central and Eastern Europe. But today on the call, we also have colleagues from across Europe and even actually friends and allies joining us from all over the world. So thank you for being here. Today and this week, we are celebrating European Mental Health Week. And so what's special for us about this is that with the team here today, we launched the Let's See initiative formally exactly 1 year ago. And we thought that it would be really worthwhile to celebrate this and share all the work that the team has been doing in this past year. And also to celebrate that, we were thinking, what is one thing that could speak to mental health, that could speak to youth mental health, but it would go even beyond our very specific aims of establishing low intensity services in the region. And that's how we thought that that concept, as of today, knowing what's going on in the world and what's going on in our region, that would very much be about the term resilience. And that resonated with so many of us. And so that's why we thought, okay, let's launch what we called the Artsy exhibition. And this is the first time that we have done something like this, but we were very excited about it because we thought what this means is that we open up space for everyone who in some way connects to the term resilience to create something about it and share that with us. And so today we are very, very happy to launch the online exhibition of Artsy. By the way, kudos to Gergana Manolova, who came up with the term artsy. She was fabulous in that. And basically, I am going to share the link to the exhibition on the chat. And what we will do is we would encourage everyone to take time after this call to immerse yourself in the submissions. There have been, I mean, really moving poetry, photos, artworks shared from across Bulgaria, Romania, Hungary, Slovakia, Ukraine, Moldova. And I really encourage you to go through them one by one because they really represent what resilience means to all of us in the region. And so I will share that link now. And with the exhibition, this is, of course, now the online representation of the work, all the pieces of work that have been submitted. But we are also planning to host in-person exhibitions. So please watch this space because we will be in touch about those as well. And maybe two things that I wanted to just, let's say, voices from the exhibition and from the artwork submitted. I wanted to briefly reflect on some of them. And one was that you see opportunity in all of them. Everyone somehow embraced the concept that you can get there, that you will always get there and you can be heard, and that it's also about community. And I wanted to say, I know that some of the artists are here on the call today. I want to really thank you for contributing with your pieces. And I think it felt really heartwarming that we even got requests from outside the very specifically Central and Eastern European region. We even had someone who got in touch from Nigeria who said that for her, this theme really makes sense. And that was beautiful. And that really was the point. So I don't want to show you just one piece of work. I really encourage you to, after the call, open this link. We will, of course, share it again and give yourself time to go through these because they are fantastic. I will stop here and I'll pass it back to Ruta as I think our speaker is with us.
Thank you so much, Jofi. And I hope all of you will enjoy this artsy exhibition as much as we did. So without further ado, I will pass it to Christina Paulik to take it away and talk about her experience in Let's See and yeah, just share her experience with us.
Hi, do you hear me? Yeah, thank you. Hi everyone, and thanks for your invitation to this workshop. I'm sorry for not being able to be here for the whole call. My name is Kristina Paulik. I'm a first year psychology master student at Eötvös Loránd University in Budapest, and I'm in the cognitive psychology specialization. And I joined Let's See via a very, very amazing project because Rita and Sophie and all the amazing girls were creating a short film about difficulties that are influencing youth in Hungary, especially like how to make a living or how to face the situations like the war and the COVID. And I was speaking about how to make a living and why is it hard in Hungary if you are a university student. So that's how I got in touch with Let's See. By the way, the short film is already visible in Let's See Hungary's YouTube channel. So check it out. Um, and I joined as an official member of Let's See. I think autumn 2025, and I'm part of the team which organizes the events. Um, and we basically have a plan to organize a workshop for youth once a month, and I had the really really amazing chance to hold the first one, and my topic of the workshop was really personal because I talked about challenges of minorities. Especially regarding to mental health. So it was, I think, pretty actual because we had elections last month in Hungary, as you all know, and you know the former government wasn't very nice with the minorities, and I. I heard so many times in my environment, my friendly circle, that this these negative events cause so many stress in people in belonging to minorities, and I'm part of multiple minorities. Like I'm a half Romani person with neurodivergence and possible queer identity. So that was the main topic, and it wasn't actually a political thing. I just mentioned the elections because that was the actuality of this topic, and basically it was like 3 days before the elections, and in the first half of the workshop I was speaking about my own difficulties, for example, minority stress and personal challenges like facing stereotypes, and I illustrated this both with scientific articles and both with personal experiences, and I wasn't only talking about the problems but also to possible solutions. For example, I was involved in human rights activism for I think 3 years or maybe even more, and I was talking about that, and I was also talking about burnout and coping strategies aside activism. So that was the first half, and in the second half, that was like not a round table, but like a conversation for all of the participants. And we were just sharing our experiences with about working with minorities, being part of them, and in fact, so many interesting comments arrived, and new new cooperation started to have the seat because there was a participant who was working with Romani people, but their methods also had some challenges. So we just got in touch. So I and it was amazing to me that I got so many positive feedbacks for this workshop, and some people asked me to do it somewhere else too. So I was thrilled about that because I didn't feel it so good, but it was really it was really personal. And yes, Rita, you are right. Do it in English, but I have to be less stressed when talking about when I'm talking in English, because right now I'm super stressed and self-conscious about every grammatical error. So I think I will stop it there. So, are there any questions?
Thank you, Christina. You were fabulous. I would reiterate what Jackie was saying. So, and thank you for doing this truly impactful workshop. And I saw that Rita added the Instagram reel on Christie's workshop. Any questions? If not, and I know Christina has very limited time with us, I will. Okay, sorry. We see one question.
Yeah, actually, it's not a question. I just wanted to support Christina that Christina, you speak very good English, and do not worry about it. It's the least that you have to worry about, and you had a very great presentation. And I'm supporting you as currently a migrant in France who is going on with the same situation but with French, and just go on and never stop. That's all. Thank you for your presentation.
Yeah, thank you for your comment. Actually, I was an Erasmus student in Paris, so I completely understand your problem. Even though I have a C1 language certificate, French classmates mocked me about grammatical errors. So, and yeah, I'm neurodivergent, so my profession is basically to be worried about grammatical errors. So, yeah, I need to work on this. But thanks,
All great, Christina, and thank you
yeah.
so much for your comment.
Thank you.
Yeah. I know, Christina, you need to run. Thank you so much for joining
Thank
us.
you.
It
Thank
was
you.
incredible.
Yeah. See you next time.
Thank you. Now we will transition to Milena, who will briefly talk about our key achievements in the past year. So I will share the slides, Milena, in a second, and over to you.
Okay, so hi everyone. My name is Dr. Milena Stanojevic. I'm a mental health service researcher and evaluation specialist, and also a research lead for Let's See. So 1 year after Let's See was launched, I'm pleased to share what has been achieved in our first 12 months. And in this short time, I would say that Let's See has developed from original call to action into a working platform for learning and evidence generation and service design and early implementation. The first achievement I would like to highlight is the creation of our regional learning and networking exchange program, led by our experienced learning lead, Ruta Rangel. So since the beginning of this year, we have held 4 regional learning sessions with the person of strengthening knowledge sharing, building regional relationships, and create kind of a learning community of practitioners and researchers, young people, advocates, and partners across Central and Eastern Europe. The program of these 4 sessions followed kind of a global to local approach, and we began with a broader, I would say, international view of youth mental health, and then gradually moved closer to the realities of our region. Across these 4 sessions, we heard from youth mental health organizations, very successful ones in South Africa and Ukraine. We heard from our team from Hungary, from Romania, Slovakia, who shared youth engagement strategies, their inspiring service models, and also practical lessons from the ground. We concluded these 4 sessions with a discussion on how we define and measure success in youth mental health programs. So the result of this program is not only these 4 sessions completed, but I would say the deeper achievement is that we are building a regional learning infrastructure, a community that can finally exchange their practice, hopefully avoid repeating mistakes, and adapt models to local realities. Now, the second major achievement is the development of our regional needs assessment. From the beginning, we knew that Let's See should not design services based only on assumptions. And we want our service model to be very relevant and grounded and responsive to the actual realities of young people, their families, professionals, and communities in general. The purpose of this needs assessment is basically to understand what are young people's mental health needs, what services are out there locally, and what is missing, but also what kind of youth mental health hubs may be most relevant in these different contexts. We thought that this, this event and European Mental Health Week would be a perfect opportunity to actually launch the wider regional survey. And we are inviting you all to fill it in. Share it with your colleagues, friends, families, young people, networks who may be able to contribute. We will now share the survey links in the chat box here, but also on all of our social media. It will become available today, and we will send it to you in a follow-up email to you all. One important feature that you will notice is that it's multilingual. At the moment, the survey is available in English, Hungarian, and Serbian, with Lithuanian and Romanian versions coming up next. And of course, it would have been easier for us to collect responses only in English, but we believe in that local knowledge is often expressed most accurately in people's own languages. We also know that there are many strong local initiatives that remain invisible when evidence is collected only through kind of international or English language channels. Do we have the survey versions in the chat box? Yes. Okay. The next thing I would like to talk about is the third major achievement for the past year, is that our impact strategy and service model are now available on the website. This is, as you can imagine, for us an important step because it makes our work more transparent, more structured, and more accountable as well. The service model really describes the core elements of what Let's See aims to offer through community-based youth mental health hubs. Including a minimum service package of interventions that can operate kind of regionally, like an umbrella, while still being adapted to local contexts. The needs assessment that I just mentioned will further inform and refine the service model together with ongoing consultations with youth and other key stakeholders in youth mental health. So we're not treating the model as fixed. We are treating it as really a living framework that will be shaped by evidence and practice and local insights. At the same time, as you can imagine, we cannot plan what we can't measure. So the impact strategy and evaluation framework are there to help us define what success should look like for us. Whether our services are acceptable and accessible. And eventually whether we are creating a meaningful change in these young people we aim to serve. And then finally, the fourth achievement is kind of our progress from strategy into implementation. And I'm particularly happy to share that the first pilot is already underway in Budapest. At the same time, teams are preparing in Debrecen, Hungary, and Bucharest, Romania, and there's ongoing scoping work around potential youth hubs in Lithuania and Serbia as well. So this is, as you can imagine, is a significant milestone for us. It means that Let's See is no longer only building concepts and networks and documents, but we are beginning kind of to translate this work into concrete local services and partnerships. I will stop here. You will hear more about the current efforts and achievements in Hungary later during the session. So back to you, Ruta. Thank you.
Thank you so much, Milena. And whenever we think about service model or any part of Let's See, what matters to us so much is your input, wherever you're calling in from. So we would like to shift a little bit our gears and hear from you. So I will try to share, we'll see how that goes, a link in the chat. Here is the link. And I will share my screen. So don't do anything yet. I will quickly explain the next steps. All right. Are you able to see my screen? Oh, good. All right. So we have a question for you. So imagine you have €500,000 to design a more youth-friendly mental health support system. So where would you invest this money? And for those working in research, 500,000 may not sound too much, but make your imagination run wild. So in order to add any ideas, you just need to put plus sign and let's say, I don't know, suicide hotline, not hotel, hotline. All right. And once you save it, you will see that it appears here. Right now, you don't see anything. I will blur everyone responses so we can just get some input before I reveal them. But please take your time for a few minutes and just add, where would you invest this money to have a more youth-friendly mental health support system? All right, and I will stop sharing so you could think. So let's take maybe a couple of minutes, unless anyone has any questions how to do this. Of course, my computer just stopped working for a moment. All right. All right, I see some ideas trickling in. Let's take maybe one more minute. And there are no right or wrong answers, just whatever. If you would say we want to establish, like, I don't know, a greenhouse where we work with, I don't know. I had too much coffee to think through some funny examples, but whatever comes to mind, feel free to add. Right, maybe one more minute. Right. So for those of you who are writing, please finish your thoughts. And in the meantime, I will reveal and see what we see here. Let me maybe make it a little bigger. All right. So we heard, let's see, work, advertisement, outreach, focused and trained peer mental health support, collaborations with a health system, securing a safe space, app and peer training. So maybe let's put it maybe together. In restructuring licensing requirements that allow mental health professionals become a core part of the workforce. Amazing. Prevention and peer education. I will try to merge it here. Hire more school psychologists, school workers, more conversations with youth. I would invest money in research looking into what young people themselves find necessary and helpful. Amazing, because they're often not seen as capable and treated as children. Very good one. I would spend about half a year, 12 months, interviewing young people and co-designing. Oh, fantastic. Oh no, I didn't merge. There we go. Young people themselves, maybe here. Investing in LGBTQ plus training for psychologists, especially school psychologists. Great open air nature hubs to encourage to spend more time. Amazing. I'm away from screens. Improving the services provided by school psychologists. So we have a few. I think I'm losing. Improving, co-creation. Young people should help design, part of the process. Great. Improving the services provided by school psychologists. Sorry, repeating myself. Prevention and promotion, mental health in places youth already go, and early understanding of emotions in schools, preschool, hiring specialists, and integrating them into curriculum. Truly, truly fantastic suggestions, and we really appreciate your feedback. And I love to see that the biggest group is actually co-designing things with youth, which we find truly, truly essential. What we want to do next is you have a lot of ideas on the screen, right? What we would like you to actually prioritize 3 ideas. What do you think that would be like out of all of this? We should spend this amount of money on only 3 components. And in order to rate, you can just click thumbs up. So if you click it, we will see that your response was recorded. So yeah, please take your time. I will again hide the cards, not to influence anyone's decisions. So just take a look, pick 3 cards, and just click thumbs up.
But I can see them, like what I choose. Do
Still
you?
can see them?
Oh,
Rita, you can still see the. Oh, right. Sorry, that was not.
just the ones that I wrote. Yeah.
What was the way that I can hide my
If you
thumbs?
click on hide vote count, if you go back,
Yes, there we go. Thank you. You see, what would we do without our outreach lead? I would have 30 people over on this call making fun of me. So thank you, Rita. Right, maybe let's take 1 more minute. All right, thumbs up if all set. All good. I see 1 thumbs up. I'll take it. Thank you, Rita. All right, shall we reveal this and see what we found out? All right. All right, so I'm very happy that Retroboard is doing a favor to me and arranging things a little bit. So it seems that all of you prioritized the importance of co-designing things for youth, exactly what Let's See is prioritizing as well, right? We want the services to be co-created with youth, not only us deciding what matters to them. We also see that, what else we have? Focused on so it seems peer mental health support is another priority that is central for you all. I don't know, surprisingly or not, this is something that Let's See is also prioritizing, and Kata will talk a little bit more how we are thinking of implementing that. And I think we have one more. So investing in building community-based mental health system that feels safe and familiar, accessible to young people, and not clinical, as well as create employment opportunities. That's truly important too, right? We need a space that it's safe, it's not stigmatizing, it's accessible to young people, and it doesn't feel like they are being pushed to do things that they don't want to be doing. Perfect. Thank you so much for participating. This is so, so, so important. And we always build our next steps from the feedback that we receive from you. One more question that I have for you, and maybe a few of you who feel like they could unmute and speak about. We would like to hear from you. What is one thing countries could work on together to improve youth mental health? Maybe, I don't know, just thinking through maybe doing some regional advisory board in order to learn from one another to see what works in one country, what could be adapted in another one. Or, I don't know, writing policy briefs. Anything that comes to your mind. Yes, yes, Evgenia.
Yeah, so basically, I would like to speak about more about prevention with all my experience, because basically I'm coming from Ukraine, but I'm a migrant in France. And once I was the project manager in the youth-led organization Teenagizer that provided psychological and psychosocial help to adolescent and young people, and still providing. Here is also presented my former colleague who is currently working there. So within the experience I had, a lot of very complicated situation, especially those concerned about the suicide. They could be eliminated by having the prevention, like by finding this point of when the young person is breaking and helping not to go along the way down. We're currently having a lot of businesses that are investing in the prevention, but mainly in the physical health, like Whoop, Aura Ring, and also they are actually very expensive services. However, like when I'm thinking about a future of the psychology and the future how of the services that are providing you the prevention, maybe one day it will be possible to involve those businesses that are using AI also and so on, to find the proper way of reducing the causes of the psychological mental health disorders, any problems and all. And of course, having the safe space for the families and for the young people. Thank you.
Thank you. Such a good point to really prioritize not only physical health, but mental health. And if I understood correctly, just doing a cross-cutting approach, right? Like through businesses, through medical
Yes,
services, through even.
yes, yes. You like the last point, because here in France, I see that they're doing those things. It's not ideal system. Yeah, but it has some impact and has some points that could be referred after in our region also. Thank you.
Thank you so much for your input. I think we have time for one more suggestion. Or recommendation.
Now we have
There was something on the chat
Thank you.
recommended.
Yep, exactly.
Thank you for flagging this. Global youth problem is the lack of a community sense of belonging and feeling heard. Perhaps those issues are ones that can and should be addressed internationally, given the scale. I'd love that social media regulation as an example. Thank you so much, Gwen. Yeah, truly, that sense of belonging is so important. Thank you. We would love to hear more. If you think of anything at all, please put it in the chat. I can assure you we'll be more attentive this time. But because we are low on time, I would love to transition to Kata, who will be the one serving you the lunch or dinner, whatever part of the world you are, the full meal of Let's See, just for you to better understand the service model approach. So over to you, Kata.
Thanks, Ruta, and hi, everyone. It's such a pleasure to have you all here, and thank you so much for joining us today. We are really excited to celebrate today 1 year since we officially launched the initiative, and we are really grateful for all your input. And I've heard lots of interesting perspectives and words that you've shared with us. I've heard community spaces, I've heard safe spaces, feeling heard, I've heard opportunity, I've heard prevention, promotion, and I took some notes here because you've kind of touched upon some aspects of our service model, and you've touched on the key elements, I would say, of our service model. And maybe I will start by saying or reiterating what Milena has already shared, that our service model, it's a live framework, and we are continually adapting it based on the feedback that we received, and we are continuously revising it after we receive feedback from the needs assessment, and after we have consultations with the stakeholders, regional stakeholders, local stakeholders. But first, I would say that based on the previous conversations and based on all the input that you gave to us now, I see some themes about what is needed structurally to improve youth mental health support in our region. And the key themes may include, as you already mentioned, community-based mental health support, creating safe, accessible spaces for young people, strengthening prevention, early support, reducing stigma, building cross-country learning, and building this regional community of learning. And the Let's See Youth Mental Health Service wants to tackle this and wants to integrate this into the framework, and is being developed and is being revised through a participatory multi-phase design process that combines evidence, the needs assessment that Milena has shared, the consultations which will follow soon, and we would be really happy if you would like to join some of our consultations. We will reach out to some of you if you'd be available and you have a bit of time to give into these consultations. We'll be really grateful. you've mentioned, a lot of you have mentioned the co-design, youth voices feeling heard. So at the center of designing our service model, we have young people, and their voices are included in all steps, and we are trying to develop it in a co-creation with young people. And the main goal of all these phases that I've mentioned before, we have 6. We've numbered them at being 6. The main aim is to develop a minimum viable service model, which you have here shared on the screen. For the youth mental health hubs, that could be implemented across Central and Eastern Europe, while of course remaining adaptable to the local systems, to the cultures, resource contexts, and so on. This minimum viable service model will be the core, the template of our service model, which then will be implemented and adapted to the local frameworks. Because I'm cautious of time, I will not go through all these phases that I've mentioned, but I want to maybe share with you a bit about what we have so far in our minimum viable service model, which we are really happy to revise after we have more input. Of course, we would include the portfolio of interventions, and these are low-intensity community interventions, and we are exploring possibilities. We have now in our mind and on our portfolio some WHO products, which we know that have been tested rigorously before, and we have EQUIP, PM+, EASE. If you have any recommendations, or if you think that there are others that might fit better in your context, please, we'll be happy to receive your feedback. This portfolio of interventions will include all the activities that we would like to implement, and of course, the evidence-based interventions and how they will look like in our respective context. Then, this minimum viable service model will have a very let's say, rigorous description of the workforce and who will be the people that will be involved in delivering the interventions. And here we are thinking about peer-led support, as Ruta mentioned. And for that, we are also developing a training program, something that in some countries is already implemented in terms of peer-led interventions and peer-to-peer support, while in other Central and Eastern European countries, this is a very new initiative. So we are trying to develop a training model and a training program that could fit into our context. Then we are thinking about supervision model, which is the core of implementation and delivering the intervention. And the supervision model, we think, helps a lot with how we avoid the burnout of the workforce, how the intervention is being implemented, and all the fidelity aspects of the intervention. Of course, the minimum viable service model will have, we are thinking about the referral pathways as well, something that has been already mentioned during this conversation. We are thinking how this model could fit into the already existing mental health services. And the referral pathways is a goal of this service model as well. We are thinking about the advisory boards for each hub, and these advisory boards will be formed also to have young people that will be involved in all of the steps of implementing the pilots, but also experts, advisors that will help with implementing the model as good as possible. We are documenting the processes for hub establishment. So this documentation, these protocol standards will be available in the minimum viable service model. And we are also developing a fidelity model, shared monitoring and evaluation framework, but also the risk management and safeguarding. These are the main elements, the main pillars that we are now revising and working on in parallel. And I'm just cautious of time. We would be really grateful, as I said, to have any feedback from you or any input. And I think that's it from me now. Thanks, Ruta.
Thank you so much, Kata. I hope it gave you a better understanding our approach and where we're aiming to move forward to. I think because in terms of the time and just to make sure that we don't take too much of your valuable time, we're just gonna briefly discuss call to action and just close the webinar. So we'll pass it to Jofi and Kata.
Perfect. And maybe just to add on to what has been said before, I was typing it up on the chat, but I'll just say it very briefly that with all this service model, what's very exciting is that we have in Budapest the first hub that has been running for about 3 months now. A lot of the team members have been putting immense amounts of volunteer time right now to make it happen. And there's a team growing now in Debrecen, Hungary. Zsuzsi, who is here on the call as well, she's heading that. And then Kata is recruiting in Bucharest to make it happen there as well. So do join these efforts, and you will hear from us in terms of how these pilots go in future. And then with that, basically, we have come to an end of this webinar. We had two main things that we wanted to finish with. And the first one is just about the next steps as to what you can expect from us, what we will be up to in the near future. And that's really about piloting the service model itself. We are, fingers crossed, getting closer and closer to getting operational funding to be able to run these pilots and actually acknowledge our volunteers' time as not just volunteers, but also to actually create employment for our people, which would be fantastic, and that will remain to be a priority. And with that, to actually have the 3 locations that we mentioned, so Budapest, Debrecen, and Bucharest, up and running. And we have had fantastic contacts from Serbia and Lithuania, and we are hoping that those locations will be next in terms of pilots, and then of course to go beyond that, but that's probably longer term. And in terms of what we would like for you to be involved in and where you can join all of this very exciting line of work, we basically have 3 things for you. And if my colleagues can help share the links on the chat, that would be great. But so first and foremost, Milena has shared a lot about the needs assessment. So we are launching that officially today. Milena told you through the languages that we are launching today, and there's more languages up and coming. Please fill them out, fill the surveys out, and please share these with your colleagues. And let us know if you have capacity for translating the survey to your local language. We want to be sure that this is as comprehensive as possible. So first one, needs assessment. Please fill it out. Please share it with others. The second one is that we have launched today the Artsy exhibition. It's an online exhibition as of now, and we are deeply grateful to everyone who has submitted. This is the launch, and what this means is that the exhibition will now be out there. You will see it. You will see us sharing it widely with our networks. We want that as many people get to see and engage with these pieces, as many as possible. Please do take time yourself as well to engage with it, because I'm sure you will have a lot to take away from it. And we will be organizing in-person exhibitions. The point of these will be to share these pieces of art and to, with an exhibition, invite in a broad community of people interested in mental health, resilience, and Let's See's work. So get in touch if you're interested in hosting one with us. And then lastly, we'll keep working on the pilot projects. So if you're interested in the methodology, if you're interested in joining us, one of our hubs, or if you're interested in trying out this methodology in your town, then do get in touch as well. So 3 things: needs assessment, please share, Artsy and the exhibition, engage and take a look, immerse yourself in the experience, and then pilots and the Let's See network itself, please join and let's make even more youth mental health work happen in our region. Ruta, back to you.
Thank you so much for closing, Jofi. And just to reiterate, if you are interested in getting in touch with us, these are our means of contact. You can find us on Instagram or LinkedIn, but feel free to reach out to us via email as well. We're very excited to have this group with us. So yeah, we're always welcome recommendations, suggestions, any ways of improvement. So thank you once again for joining us today. And if you have time and have any questions, we're happy to stay a bit longer on the call to answer them. All right. Thank you so much.
Thanks everyone for joining.
Thank you.
Thank you, everyone.
Thank you so much for this webinar. Bye,
Thank
everyone.
you.
Have a nice day,
Bye-bye.
evening, morning.
Bye.
Bye.
Bye.